Hello and welcome to Thursday's edition of NBC Current Affairs. I'm Jerry Tave. Thanks for joining me. Now tonight I'll be speaking with Charles Abel. He's the former member for Alotau Open and he's also the former Deputy Prime Minister and a long-time advocate for rural health services. And he's been recently appointed as the ambassador of the Hands of Rescue, known as Thor, and the renowned flying doctor service dedicated to maternal and child health in Papua New Guinea, especially in the remote areas. Mr. Abel will talk to us on his participation and experience in the significant program and how it's transformed the healthcare delivery in isolated regions, saving countless of lives and through its emergency medical services, particularly focusing on obstetrics areas and medical evacuations. Mr. Abel, welcome to NBC Current Affairs.
Thank you so much, Jerry. It's good to be back, and nice to see you. The NBC staff are still working. Nice to see the old studios, as old as they are, still in action.
Thank you. Now we'll get straight into it. Firstly, tell us about the Hands of Rescue or Thor program, and what was the motivation behind becoming an advocate for rural health services in Papua New Guinea?
Thank you. Yes, no, my association with Thor began actually from my time as a Member of Parliament, and in particular as a planning minister, and as part of our strategy to help government deliver services to our remote rural populations, we were thinking about innovative solutions and ways to extend our services to those people. And so one of the ideas was to engage with innovative partnerships. And as I was mentioning at the outset, there are many good non-government organisations out there that actually provide good services. And while our health system is struggling, one of the ideas is for government to support these partners and engage with them to extend our health services. I'm using health obviously as the example because that's the applicable area here. Yeah. Partners like Thor, the Hands of Rescue, are already working in the area. They've already committed financial resources. People like the champion Dr. Barry has committed his life to such activities. So obviously given that relationship and then continuing my life after Parliament, Dr. Barry reaching out to me, it's the least I could do, I thought, to continue that partnership and support such people. And as I said, there's many others actually doing it. Dr. Barry operates in his area, but there are people like Mission Aviation Fellowship, Samaritan Aviation, YWAM itself, of whom I'm also a patron, St. John's Ambulance, and many, many other good people with champions behind them are doing such a wonderful job. If I can help in any way to some of these organisations, it's my absolute pleasure.
Yeah, okay. Now, what is your view of on the role of Thor in improving maternal and child health, especially in remote regions?
Yeah, no, as I was saying, and all of us know that in Papua New Guinea, in our remote areas where most of our people live, we are struggling to deliver services out there. And so one of the particular areas is maternal mortality. We have 730 out of every 100,000 births in Papua New Guinea of deaths, maternal deaths. So it's a huge issue which affects the whole community, but obviously mothers. So having that extension of services, having a medevac plane being able to get out there when there are complications, as well as many of the other activities Thor does around that, like building maternity ward.
You know, trying to reduce maternal deaths is not a thing that you stop overnight. Yeah, this is our first waiting house we built at Sayalaya, and we built it for the long distance mothers up on the mountains behind us here.
Providing obstetric kits, providing training, even simple things like paying the fee for the mother to access the health centre, because in the past certainly you have to pay to access the health centre. So there's a lot of reluctance of our mothers to go down to the health centre to deliver. As a result, when there's complications in the village, they're not able to be supervised and it results in many of our mothers dying and or the child dying as well. So Dr. Barry's intervention is about the well-being of mothers in delivery, and so all his activities do that. And he has literally saved hundreds of lives, reaching out to far-flung places, remote islands and mountains to deliver that service.
And I know you have a lot of experience as well while working with Dr. Barry Kirby. Is there any specific experience that's impacted you personally?
Yes, there was a particular time. There's been a few, but there was a particular time in the local level government area of Makamaka, which is on the border with Oro. I was out there doing my work as the local member, and Dr. Barry flew in to deliver some medicines. And while he was there, and I took the opportunity to go and say hello to him. And when I was there, one of the mothers ran up with her baby with the umbrella and said she was talking to Dr. Barry. And I said, what happened here? And she said, that Dr. Barry saved my baby's life. And that baby was named Barry after him as well.
Wow.
So it was just like a total coincidence. But in that moment, I could see an example of how Dr. Barry has touched lives. Even if it was just a random moment there, it was a perfect example of the kind of work Dr. Barry does.
Okay. Now, in what ways has the Thor service transformed healthcare delivery, especially in isolated areas in Papua New Guinea?
Yeah, so doctors, he's obviously only one man with Sister Keela and one aeroplane at this stage. He's hoping to do more. So he's only able to really cover a limited area. And in Milne Bay, it's been 19 health centres that he's been effective. That he's effectively been able to help, and those surrounding areas. So in those areas, as I've mentioned, he goes out and conducts training of the staff, particularly in emergency situations that related to childbirth. For example, when there's obstructed placenta, or when the mother is bleeding out. And so the first thing he does is make sure that the health centre staff, the nursing officers, the midwives and the orderlies are trained in such situations. And they actually use the state-of-the-art mannequins or dummies, which are obviously where they can use them as an example of a child being delivered, and then they mimic bleeding and so on, and how you actually use that mannequin to address it. He's done things like paid the access fee for the mothers so they don't have to pay that when they get there. He's provided market money to the mothers. So when they don't have the food, they're able to go to the market and access food. He's built maternity waiting wards for the mothers so they can stay there. He's provided baby bundles so that when the mother gives birth, she gets a bathtub with nappies and other things in there. Even a bush knife and fishing line for the father, so that these issues of access to money, because of money, sometimes a distance, they feel like they don't want to come in and access the health centre. By providing these incentives, particularly to the father, it makes the father less reluctant to delay the process until it's too late, you see. So he works with the staff, which is the existing health system, which is very important. He helps with the maintenance of the wards. He provides solar lighting in the labour delivery rooms. He has even gone as far as paying 20 kina per delivery to the attendants, you see. So then they are also incentivised. And as I said, he gives those basics to the mothers so they feel there's a reward even so they can come down. The issue is that a lot of our deliveries are unsupervised, which is fine in the majority of cases. But if there's a complication, you're in trouble now because you don't have that access to the health services. And the last one is he provides obstetric kits, including a vacuum equipment to vacuum the baby out when it's stuck. And then ultimately, of course, when it's too difficult, that's when the plane comes in and potentially flies the mother out. This plane flies sometimes 5 hours in a round trip. If you imagine places like Milne Bay and all the way to Rossel, it's almost to the Solomon Islands, or it's at the border of the Solomon Islands. It's like flying to Moresby and back, or Cairns and back. So there's a range of measures that he undertakes to provide that service. And he's struggling, to be honest, on his own to maintain the plane, because most of the money comes from his pocket.
And this plane, is it the only one, or there's other fleet there?
It's the only plane that he has, which he's bought with his own money, and he very much wants to buy a second plane.
Yeah.
So that's part of the intention and the aim, to raise money to purchase more planes and service more areas in Papua New Guinea that are currently not covered by such a service.
Okay.